Hello, how are you? Welcome to a new installment of your pharmacy assistant. On this occasion, we will talk about what it is used for and how it is used. So let's take a look.
Hey everyone, today we're going to talk about something really important for many of you, Levonorgestrel. This medication is known for being used as emergency contraception. When do you use Levonorgestrel? Mainly to prevent pregnancy after having unprotected sex or when your usual birth control method doesn't work. For example, if a condom breaks or if you forget to take your birth control pill. And how does it work? Well, this medication works by preventing you from ovulate, which means it stops your ovaries from releasing an egg. It can also change the lining of your uterus, making it harder for a fertilized egg to attach. Now let's talk about how to take it. It's super important to take Levonorgestrel as soon as possible after unprotected sex, ideally within the first 72 hours. The normal dose is a single pill of 1.5 milligrams, although some treatments recommend taking 2 pills of 0.75 milligrams each, 12 hours apart. Like all medications, Levonorgestrel can have side effects. The most common ones are nausea, tiredness, and stomach pain. It's also important to remember that it shouldn't be used as your regular birth control method and that it doesn't protect against sexually transmitted infection. Finally, remember to always talk to your doctor before taking any medication and follow the instructions they give you. I hope this information has been helpful and that you now have a better understanding of how to use Levonorgestrel. Take care.
If you've made it this far, let us know in the comments why you're using this medicine.